Hey everyone, it's Peter here with physicaltherapytv.com. In today's video, I'm going to just quickly cover herniated disc exercises. Just wanted to point out that the information you're about to see is for information purposes only. Since I'm not a doctor, I want you to take that into account and make sure you clear that with your healthcare professional or your doctor first. I'm going to take a little bit different angle on herniated disc exercises. There is no silver bullet exercise that's going to reverse your herniated disc. Anyone who claims to advise or sell information that says you're going to do this and this is going to happen, I would be very leery of. It's very important to determine exactly why you are getting a herniated disc. And typically in practice, and this is excluding if you've gotten a herniated or bulging disc from an accident or any other reason, would be either a flexibility or a stability issue. What I mean by flexibility is typically there is a restriction in the muscle length and the joint mobility. If that occurs, it can lead to some changes in your spine, including a herniated disc. Many times people also have a stability issue. That refers to your core strength, those deep muscles of the abdomen and lower back that keeps your low back and your hips and pelvis stable when you perform different activities such as walking or running. So you got to distinguish what kind of issue you're dealing with. Many times it could be a combination of flexibility and stability. A good way to determine if you're dealing with stability or flexibility is to perform a single leg balance test. You perform this exercise preferably without shoes. Try and hold your balance for about 10 seconds standing on one leg, and then do the same on the other side. You want to be nice and even and steady, and both sides need to be the same. Typically you'll find that people are weaker on one side and then they lose their balance and have extra movement to maintain their balance. That would be deemed as a fail on this exercise, and the reason for that could be because of poor core strength and poor flexibility. Now, flexibility exercises, since I've promised some exercises here, I like to target most of the joints in the lower body. There's much more you can do, but this is just a quick sample, and that would be active hamstring stretching, seated rotational stretch for the glutes and piriformis muscles, standing runner stretch where you target your hip flexors and your calf muscles. Those are great exercises that can improve and normalize a normal joint range of motion and muscle flexibility. The core strength or the stability exercises that I refer to would be these kind of exercises. Any static hold exercises that fatigues the muscles of the abdomen and low back. These side plank and plank exercises are great. These are two advanced exercises. If you want to start with the lower graded exercises where your knees, for example, are touching the floor and you have less strain. But this is the type of exercises that will strengthen and promote the health of your spine. There's some free information over at lowbackreport.com. There's a link below this video if you need more information and help for herniated discs and low back pain.